My name is John Joseph O'Connell, and I'm a radiation oncologist. I was born and raised in Maryland, outside D.C. I went to West Point for undergraduate, went straight from West Point to medical school, attended Georgetown University Medical School, and from there I spent the next 21 years as a physician in the U.S. Army. Was trained in radiation oncology. In the last 14 years, I was practicing radiation oncology at Walter Reed almost every day, but for about 15 months when I was in Iraq. I got back in '07, got right back into it. 2014, I retired. My wife is from Tampa, Florida. Being from Maryland, we were looking to settle anywhere between Maryland and Florida. I've been married to my wife since 2000, and we have 8 wonderful children. I chose to specialize in radiation oncology. My undergraduate degree was in electrical engineering, and I really enjoyed hard sciences, physics. Radiation oncology was a natural fit to my skills and talents that I had at the time. But I really fell in love with the specialty when I did my first rotation in it, and just the exposure to patients, to be able to care for patients who have cancer, was something that I fell in love with and have enjoyed ever since. I enjoy coming to work every day because of the challenge, but most of all because of the patients, the ability to really help and aid folks at a time in their life when they, where my training and what I do can make a difference in their life. And so it's an enjoyable, especially there's many challenges, but many rewards. I like to do research. I like to apply what I learn and continue to learn for the benefit of my patients. I like to investigate ways to make radiation safer, more effective, and with less side effects. I would describe my style of practice as one in which I respect the patient and their family and the choices they have, and I try to see myself as a provider of information so that the patient can be well informed and make the best possible choice for themselves. I chose to practice medicine at Prisma Health for a myriad of reasons. Originally being from Maryland and my wife from Tampa, we were looking for a place after retirement from the Army to practice medicine, anywhere between Maryland and Florida, and I fell in love with the upstate and chose to practice here for several reasons, primarily because I felt like this presented a wonderful opportunity for my family. It would be a great place to raise children and practice medicine. When I'm not at work and I spend as much time as I possibly can with my family and my children. I enjoy very much participating in their lives. I think the advice that I would give my patients that perhaps they might find most valuable is that they have choices in their providers, they have choices in how their care is given and how aggressively their care is given. And so the advice I would give is that they want to choose a provider and make choices in their care that they're most comfortable and confident with. If you would like to make an appointment with me, you can do so by calling the number on this webpage.